Hello, everyone. Remind me to thank Mike for that original introduction. All day. Yeah. So, like Mike said, I am Michael Jackson with Adobe, no relation, in case you were wondering. But I am here tonight to talk about digital engagement and healthcare. So you have to pardon me if I swing around to see what you can see. But before we begin, I just want to make sure we're on the same wavelength, right? Because both of those topics can be very, very, very broad. So for purposes of tonight, when I say digital engagement, I'm talking about personalized experiences. Feeling like enterprises are speaking to you directly, an audience of one. Combine that with the ubiquity of the experience. Regardless of where you're accessing the experience or your healthcare data, whether it's a smartphone or a tablet or a laptop, you should be able to follow that experience or have that experience follow you wherever you are. Start on one device, finish on another right where you left off. And when I talk about healthcare, specifically tonight, I'm talking about access to care or the funding of care. More specifically, payers, whether it's a public payer like Medicare or Medicaid or a private payer like Blue Cross Blue Shield. Right? So now that we have that out of the way and we're all on the same page as far as digital engagement and healthcare, I'll start with a question. We can all relate to this, right? All of us has been here at one time or another. So the question is, why do enterprises pay more to deliver experiences like these? And these types of experiences aren't unique to the DMV. They're rampant everywhere, but particularly in organizations that are somewhat laggards when it comes to embracing the various components of digital engagement. So who wins in this type of environment? Certainly not the people in line, not the poor clerk who finally gets up, who finally gets to see these frustrated people one at a time when they make it to her. So who wins? It's not some people might say, oh, it's the DMV because these people in line don't have a choice. But the fact is, when the DMV realizes it, they're paying a lot more money to deliver these types of experiences when they realize online a transaction may cost them 10, 20 cents each, but in person it's upwards of $10. So who wins? So it's a hypothetical question, but before you think about why enterprises pay more to deliver these types of experiences, we have to understand how we got here in the first place, particularly in healthcare. So let's talk about systems of record. Right? 20, 30 years ago, these systems of records were put into place to handle transactional functions. Whether it's a mainframe or an AS400, whatever the case may be, they were put into place to handle specific tasks. Right? So based on that task, that would determine which one of the systems of record you would access. So what we're looking at here is just a series of standard tasks that any health payer might try to undergo or try to carry out. Whether it's claims management, minimizing fraud, waste, and abuse, distributing EOBs, explanations of benefits. So regardless of what it is that you want to do, that would determine which system of record you would access. And 20 years ago, it all happened behind the wall. Now today it's a firewall. Back then it was a brick and mortar wall. But regardless, that dotted green line that you're looking at represents the wall that it all happened behind. So now fast forward to today. And we all are these connected consumers, and we've got these expectations that have been conditioned by our interactions on Facebook and Amazon and all these personalized, always on, always connected, personalized experiences. So we're living in a world of systems of engagement, but we're still interacting many times behind the scenes with systems of record. So what happens when you try to force a system of record below the green dotted line into becoming a system of engagement? Well, if my grandma were here, she'd say, you get a hot mess. And that hot mess is where digital engagement can meet healthcare. So now think back to that first image, right? Lots of people standing in line. Imagine you're one of those people, and you finally make it, first of all, into the building, and there's that long snaking line with the red velvet ropes to make sure you stay on track. What happens when you finally make it up to that clerk on the other side of the desk? Typically, while you're in line, you fill out your form on a clipboard, and when you finally make it up to that poor lady or guy, you hand it to him or her, and what do? They take the clipboard and they sit it right next to their keyboard, and they enter whatever it was you wrote a half hour ago when you first picked up the clipboard. How crazy is that? What's happening is those few people behind the counter are the only ones empowered to interact with your data on your behalf. And 20 years ago, when these systems of record were put into place, all industries were that way. If you wanted to book a flight, you had to call a travel agent. If you wanted to buy stocks, you had to call a stockbroker. Well, now those industries have evolved, but we're finding that government, and healthcare in particular, is slowly coming around. So I don't have a lot of time, and I'm not going to go down each one of these bullet points, but I'm just going to quickly touch on the two most important, what I think are the two most important, the first one and the last one. The first one is the shift in public sector healthcare. And I use an analogy called bouncers to bellhops, right? A few years ago, public payers like Medicare, Medicaid in particular, had this bouncer mentality, where they would just kind of cross their arms and say, I need to know that you are eligible for this benefit. If you don't belong, you won't get it. And that's okay, right, when you think about budgets and you don't want to spend needlessly. But the whole purpose of the Affordable Care Act is to extend care to as many people as possible, because we understand that spending on preventative care is a lot less expensive and a lot smarter than spending on acute emergencies, right? So now they've gone from being a bouncer to a bellhop, like, welcome, let us help you find the plan that's right for you. Let us match you with your subsidies. Let us do all this integrated eligibility to make sure you are taking advantage of all the benefits that you're entitled to. And then the final bullet point is the big market shift that's taking place in the private sector, where we're going from B2B to B2C. So now all of a sudden these private insurance companies are not sitting around some big table talking to employer groups and talking to brokers, but instead they have to come up with ways to talk to you and to me and personally engage with us. These are the same people that have these really high expectations and conditioned expectations from Amazon and from Google and from all these other consumer applications. So that's why it's important for these market shifts not to be taken lightly, because these are fundamental changes that these enterprises have to cope with in both private and public sectors. Now you combine that with the mobile revolution. That's not news, we've all seen that before, right? Twice as many mobile devices have shipped compared to PCs. But there are two stories behind that headline. The first story may surprise you. The second one, maybe not so much, but they're both important. The surprising one is that the fastest growing segment among mobile device adoption is those who earn less than $30,000 a year. That may be a little counterintuitive. You're like, how can that be, right? These people have the least amount of disposable income. Well, the reason is because when they pull out their mobile device, that mobile device for them is their access to email, to the internet, to services, to eligibility, to job searches. Everything is in that one device. And many times they're transient, right? Their addresses change more often than their phone number. So we're finding that if public sector agencies like Medicaid want to develop relationships with those types of people, it would behoove them to come up with a mobile strategy that would reach out to them. All right, now in the private sector, the other headline, the one that's not so surprising, is that the group that takes the most benefit or leverages all the capabilities of their mobile devices more than anybody is that younger group, right? 20s to mid-30s. That's important to the private sector payers because those are the people who are young and healthy and least expensive to insure. So those are the people that they really want to develop relationships with, because in order for this whole health reform thing to work, everybody has to participate. So we have to get those young and healthy people, and the private payers realize that. So it works well with the mobile strategy. So I'm going to wrap it up by talking about how we shift from being those systems of record transactional systems to really engaging with consumers. Well, what we've done is we figured out that there are typically 5 steps to how consumers make decisions. And if agencies or private enterprises can identify and relate with those steps, they'll find themselves building relationships, not just facilitating transactions. So the first step is to learn. For the consumer, now this is from the consumer's perspective. There's an old saying, build it and they'll come. Well, in health IT, that's the exception more than it's the rule. You could build the best insurance exchange in the world, but if nobody understands that it's not just a meeting place for death panels, then they're not going to come. So you have to do community outreach and awareness and campaigns, just like you're selling a widget, right? You have to build awareness about what the solution is in the first place. This next step from consumers is a new one. In the past, if you wanted to sell a product or raise awareness, you would just put together a message and send it out there. Well, now today, the second step is validate. People can check their social media networks and say, okay, what types of experiences do other people in a similar demographic, what types of experiences do they have with this product or service that you're trying to sell? So me, I would go on and say, okay, I have 2 young kids. What type of kids benefits are there for people in my zip code, in my age range, in my income? So social media allows consumers to validate the message that's being delivered to them. So, okay, now the third step. Person learns about what it is you're trying to sell as a private payer. They validate that it's credible. Third step is to actually enroll. So that needs to be simple. That's what health insurance exchanges are all about. Comparing apples to apples, making decisions, and enrolling. Starting on one device, completing it on another one, having integrated eligibility behind the scenes, confirming that you're a citizen, entitled to subsidies that you apply for. It all comes together, but it needs to be in real-time, seamless nature for the consumer. Okay, now you're a member, you start to use the benefits. You want to do more than just see a doctor and receive an EOB. There needs to be a relationship nurtured. There's a whole list of steps to think about when you're doing that. And now finally, this is probably the most important and the hardest to swallow for private payers, is commit. How do you get a new member who's only been with you for 12 months to commit to your brand? Think about yourself at work, right? Say you have several options. And you're young and you're healthy, you only see your doctor once a year for your annual checkup, which means you only interact with your health plan once a year. You get that one EOB. So then 12 months later, you get your open enrollment. And you're saying, okay, I'm with Blue Cross, but Cigna is $10 cheaper per pay. What's to keep you from just jumping ship? If they haven't built a relationship with you between open enrollments, between annual checkups. If you're young and healthy, what's to increase that sticky factor? So that's what commit means. And that's what a lot of these agencies and enterprises are struggling with. So you wrap that all up, and that is the digital experience. And what's interesting is that those steps don't always happen in sequence. They happen all over the place. So I'll wrap it up with this one final thought, the basics. What is digital experience in healthcare? So we're in a bar, so I thought I'd give you a bar stool analogy. Think about digital experience like a 3-legged bar stool, right? The seat of the experience is, the seat of the stool is the experience itself, and it's supported by 3 unique legs, and they all have their role. The first leg is engagement, front-facing engagement, that brings people in and provides intuitive experiences. The second leg is efficiency, business process efficiency, automating workflows and streamlining processes behind the scenes. And the third is effectiveness, measuring the effectiveness of the first 2. So with that, I'll just leave you with some examples of how we've helped agencies in both private and public sector with all 3 of those: engagement, efficiency, and effectiveness. And I thank you for your time.